Well, hello. This is Dr. Michael Thorpe again, general surgeon in Muncie, Indiana, talking to you about GERD Awareness Week. Today's episode is about reflux surgeries and therapies. We've already discussed a lot of the anatomy, defined a lot of terms, and talked about the medicines that we take. We're going to talk a lot about the different procedures that can be done for reflux, to correct reflux. I want to just, kind of disclaimer, this is not prescribing anything to any one individual. This is truly informative, answering any questions that you may or may not have. Okay. First thing we're going to talk about is the classic management of reflux, a classic surgery called a Nissen fundoplication. All right, let me see what let me break that down into regular words. The top of the stomach up here is called the fundus. Well, and we know in reflux, part of the problem is right here at the bottom of the esophagus. Where the esophagus comes and joins in with the stomach, there is a series of muscles kind of interwoven, like fingers that kind of compress and help to squeeze the esophagus. Well, those muscles are out of alignment. They're out of arrangement. Somehow they're not working. And the bottom of the esophagus works as a valve to prevent fluids, food, and everything else, acid, from going up the esophagus. In this picture, it doesn't show a hiatal hernia, but oftentimes it is associated with a hiatal hernia. Well, if you take the top of the stomach and wrap it behind the esophagus, kind of behind and in front, you create and you sew it together. You are plicating it. It's a sewing term, plicating the two things together. And you can see the shadow of the esophagus behind here, but the stomach is wrapped around. And it creates on the inside of the stomach, it creates a new valve so that when food, a liquid, enter the stomach, it cannot go up into the esophagus. So recreating a valve. In fact, it's what we call a non-physiologic valve, or a valve that it's not exactly what our original valve did, but it's a really great valve, and it's a one-way valve. Things go through and don't go back up. Some side effects of this procedure, because it is a valve, a new valve is put in place. You can get bloating, you can get rapid emptying of the stomach, you can get difficulty swallowing. Most of the long-term complications come from some sort of bloating or inability. Some people cannot belch, some people cannot vomit, and because it's this valve has been sewn in there, and now the reflux is decreased and significantly improved, but there are some other side effects of it. So we're trying to recreate this valve. That's the whole thing. We're trying to recreate the valve, and there is a variation of the Nissen called the toupee. If you envision that previous slide showed the stomach wrapped all the way around the esophagus, this one wraps it only part way around. See, it's attached here on the side and attached here on the side. It's not attached to itself. So it's just a variation on the previous one, but it's still a type of fundoplication, or it tacking the top of the stomach to the esophagus. So again, it's repairing the valve. But right here, this is a different procedure done through an endoscope. It's done through a camera that GI doctors typically use. And this endoscope is put down inside the stomach. A special procedure approach is done, and these little clips are placed. And these clips kind of tack the stomach to itself on the inside, recreating that valve that we've been talking about. Okay. So a lot of the procedures we're dealing with are recreating the valve, somehow bolstering, supporting the um, the anatomy, which has fallen apart. The most recent development within the surgical realm is something called a LINX device. This is a band of magnets that goes at the bottom of the esophagus before the stomach, and it sits on the outside of the stomach, outside of the esophagus, and strengthens. Not really, it acts kind of like a belt and suspenders. It just sits there. It doesn't do anything until you swallow. And in the second picture, you can see that it's opened up. And in the third picture, it goes back down. So it's supposed to sit there and not do anything. It's a little ring, and I'll pull up a different picture here. There's a little ring of beads that are magnetic, and they don't collapse on themselves. They just sit there around the esophagus, providing kind of additional support. And when you swallow, they'll open up because they're magnetic. They just kind of spread apart, and then they come back together. I'll show you some pictures of that. This is what it looks like. This band of beads is the LINX device. That's about the size of it. And it just goes around the esophagus, expands open when you swallow, and it shuts back down after the food goes through. All right. So the treatments for reflux all focus around the bottom of the esophagus. How can we support the bottom of the esophagus or restore the valve at the bottom of the esophagus where it meets the stomach to prevent the acid from going back up into the esophagus? The other component of all this is the hiatal hernia. The hiatal hernia, like we talked about, is part of the stomach going up above the diaphragm. Here's a really good picture right here. You see a part of the stomach going above the diaphragm. Well, that's a problem, because if we're trying to fix the bottom of the esophagus, if we're trying to repair this valve, if this valve is out of position, if this valve is not where it's supposed to be, we're not going to be able to fix it. So we've got to bring that valve back to where it's supposed to be. And that's done through a procedure called laparoscopic hiatal hernia repair. Here's just some images of some what we call trocars, or small tubes that are used to place through the abdominal wall to make it so that the surgery can be done. And then in this picture over here, you see a green circle. That green circle, you can look inside it and notice that there is a defect right there, kind of a shadowing defect. You can see that. That's an example of a hiatal hernia, where that hole in the diaphragm is too big, and part of the stomach is up inside that hole. So to truly repair the reflux problem, this has to be repaired. This has to be treated in order for the problem to go away. So some of the pictures you see down here, this is of the hiatal hernia as it's been dissected free. This is when after that opening was already kind of surgically manipulated, and everything is where it needs to be. And then this is a picture right here. You can see little stitches placed in there. Those little stitches have closed the hole. Look at that. The hole is no longer there. The hole is gone. It's back down to a normal size. And in this picture, a fundoplication was done where that stomach was wrapped around the esophagus. All of this is recreating the valve at the bottom of the esophagus. On all of these procedures, there's problems with swallowing. Not so much problems. It's a side effect, or it's a known development that after these procedures are done, swallowing is going to be an issue for a time. It's always going to happen. And then just over time, the swallowing gets better as scar tissue softens, as things begin to heal, and you get back to normal. There are other treatments out there that are designed to help the lower esophageal sphincter. Not as many of them are as prominent or widely used as these. These are the big ones. These are the big, most common. If you were to go type in reflux treatments, reflux surgeries, reflux procedures, these ones will probably come up. We have the Nissen fundoplication, or the NISSEN Nissen, where the stomach is wrapped around. There's the TIF, where that camera from the GI doctor goes in and is does that, kind of that bend back on itself and puts little tacks to secure the stomach to itself. And then you have the LINX device, and that LINX device, what we call augments the lower esophageal sphincter and helps to give it extra strength. All of this is combined with a laparoscopic approach through tiny little incisions, allowing the surgeries to be done with very small holes, very small cuts, helping patients get back to work faster, get back to life faster, have less pain, and so on. So I hope you enjoyed this episode. If you have any questions, put them in the comments. Feel free to subscribe, and feel free to ask any questions or about any future types of procedures or information not related to reflux, but related to general surgery that you may want to know. You have a great day, and hope your Thanksgiving was a good one.